beautiful spring day. The birds are chirping, the flowers are blooming, and all the colors of spring coat every single aspect of nature. Now, imagine you couldn't feel these sensations, hear these sensations, or even see them. Have you ever asked yourself how you're able to interpret these sensations? Well, the special senses, which include the nose, the ears, the eyes, your touch and taste receptors, are what help you interpret these sensations. Now, think of the special senses as kind of an antenna for the body. Like an antenna, the special senses will collect and transmit external sensations that will be interpreted by the brain and allow you to feel every single sensation.
The function of the special senses is to detect an external or internal change and convert the stimuli into a nerve impulse. After this, the stimuli must pass through the neural pathway into the brain, and then the sensation is perceived. For example, the external changes are sight and hearing, while internal changes would be temperature change or pain. The special senses can also initiate protective reflexes only if danger is sensed. The receptors that send impulses to the brain through the nervous system are photoreceptors, mechanoreceptors, and chemoreceptors.
In order to keep the special senses healthy, it's important to get an adequate amount of rest, reduce any stress going on, drink a large amount of water, refrain from smoking and drinking alcohol, following a proper diet, and exercising properly.
Things to make our system unhealthy are not wearing protective devices over the eye, causing permanent damage. Eye strain brought on by staring at a computer screen for hours is an increasingly common problem in the modern life. To prevent it, you should take a break and focus on an object far away.
Excessive exposure to loud sounds can damage heart, hair cells in the ear that cannot be replaced. Operating modern machinery without wearing protective ear devices or listening to loud music for long periods of time both contribute to hearing loss. Minimize contact with smoke and household chemicals like insecticides. They can damage nasal membranes.
There are many diseases related to the special senses. One of them is Meniere's disease. Now, imagine you're at Disneyland and you just got off the teacup ride. You're super dizzy and the whole world feels like it's spinning. Now, this feeling will only last a couple minutes, but imagine feeling this way all the time and feeling like you can never get off the teacup ride. Well, this is what people feel when they have Meniere's disease. Meniere's disease is fluid buildup in the inner ear that creates a feeling of vertigo and imbalance, vomiting, headaches, and different things that will overall cause the person to feel off balance. They will not be able to hear and have other issues. There's no specific treatment for this disease other than rehabilitation for the person to go to different therapies so that they can manage their vertigo episodes, and taking medication and overall even a surgery to help them with their disease. You can also prevent it through maintaining a low sodium diet. In this way, it will prevent not as much fluid buildup in your ear, and it will eventually maybe not allow you to get this disease. 12 out of every 1,000 people get this disease, and usually the age of onset is between 64 and older. However, the prevalence has been found to be mostly in female and in Caucasians. So, the teacup ride doesn't seem that bad now, does it?
Has anyone had a taste disorder? Dysgeusia is the disease for different taste distortions. There are two types of distortions, qualitative and quantitative. Qualitative is usually wrong taste or perception, such as parageusia, and the presence of an unpleasant taste. Photogeusia. Quantitative is the complete loss of taste, ageusia, the partial loss of taste, hypogeusia, and the enhanced sensitivity, hypergeusia. Each distortion is classified for its specific symptoms. There is no specific treatment to treat a patient. Everything is dependent on the patient and their lifestyle. There are medication substitutions, proper oral hygiene, and change in diet in order to prevent dysgeusia. Some patients will also recover on their own, but The ones that most likely will not recover are the ones who are born with this disorder. More than 5% of the United States have said that they have experienced a taste disorder. It is more prevalent in older adults than any other people, at a highest of 13.9%.
Anosmia, a disorder of the nose that causes a loss of smell. The main cause for permanent anosmia is due to head trauma, and the main cause for temporary anosmia is due to nasal congestion from colds or infections. Anosmia is common in young adults and children because they are more susceptible to infections as well as getting injured in activities. There's no current treatment for anosmia, but there are clinical trials going on using a chemical compound called zinc gluconate, which is zinc and glucose combined to help and treat the 2 million people suffering from anosmia.
One disorder pertaining to the touch sense is hypoesthesia. Hypoesthesia is the reduced sense of touch and sensation. Hypoesthesia usually occurs in the peripheral nervous system. The nerve dysfunction in the central nervous system may occur due to loss of sensation to the sensory stimuli. Some of the signs and symptoms for hypoesthesia of the face are numbness of the skin, nose, and cheeks. Treatment for hypoesthesia consists of tricyclic antidepressants block nerve signals that are sent to the brain, and anti-seizure medications alter the body's perception of pain and reduce numbness.
Do some men ever feel they see certain colors faded or maybe get some mixed up? You may want to go get tested to see if you're colorblind. Colorblindness is a genetic condition caused by a difference in how one or more light-sensitive cells found in the retina of the eye respond to certain colors. These cells called cones sense wavelengths of light and are enabled to retina to distinguish between colors. The difference in sensitivity in one or more cones can make a person colorblind.
Glaucoma is a group eye disorder that have few symptoms in their early stages, but eventually leads to damage of the optic nerve, which means the bundle of nerve fibers that carries information from eye to the brain, which can then lead to vision loss or complete blindness. The prevalence from 2016 was that more than 3 million Americans were diagnosed in just the year. 2.7 million of 3 million were age 40 and older. Globally, 60.5 million had glaucoma in 2010, given the aging of the world's population. This number may increase to almost 80 million by 2020. Glaucoma often has no symptoms other than slow vision loss that include eye pain with nausea and sudden visual disturbance. It is most commonly seen in people in African descent.
Our senses help us understand our surroundings through sight, smell, hear, touch, and taste. It allows for the body to respond to an internal and external changes to maintain homeostasis. So next time you're enjoying your spring day, you can think back to how the special senses work to allow you to hear, see, smell, taste, and touch. Imagine all the things you would be missing out on if you didn't have your senses.